Hey guys, Nurse Alyssa here. Today we're going to be talking about Calcicare Silver, which is a silver alginate. But first, if you could hit like and subscribe, it would be greatly appreciated. So let's get started. Calcicare Silver is a sterile nylon dressing that combines calcium alginate and ionic silver. It is a broad spectrum antimicrobial, and the calcium alginate based sheets is highly absorbent and in the presence of exudate form a soft gel pad for the wound. We're going to use the Calcicare Silver on wounds that have a moderate to large amount of exudate and they have signs and symptoms of a local infection because it is an antimicrobial with the silver. And it can also be used for minor bleeds that are superficial. It can help it stop the bleed. A precaution for the Calcicare Silver, we're not going to want it to come in contact with any electrodes or conductive gels, and that's with any silver products. Some contraindications, so we're not going to use this for patients who have an allergy or sensitivity to silver. We're not going to use it with surgical implants. So if somebody has had a shoulder replacement, you're not going to want to use that just in case it comes in contact with the appliance. You do not want to use alginates with appliances. We are also not going to use silver products in general with any oil-based products, so like petroleum jelly. And we're not going to use a silver product if somebody is going in for an MRI or a radiation therapy. It can be used, just not during the treatment. Before applying the Calcicare Silver, just like any wound product, you want to make sure that the wound is clean before applying. So you're going to clean with normal saline, making sure all the debris is gone from the wound and peri-wound, and then you're going to dry the peri-wound. When applying the Calcicare, you're going to apply it dry into the wound base. You can layer the sheets depending on how deep the wound is. For packing, when you go to pack a wound, as in any wound care products, you always want to try to use just one ribbon and make sure that you leave a piece out of the wound so it can be easily removed. After you put this into the wound base, you want to make sure to cover with an appropriate cover dressing to maintain a moisture balance. To remove the Calcicare Silver, you're going to gently remove with forceps. If it happens to separate, you're going to irrigate very well, getting all the little fragments out of the wound. Little pieces of gel are biodegradable, but you do want to try to get it all out of the wound. Frequency of the dressing change. So the Calcicare Silver, the silver does last up to 7 days, but it depends on the amount of exudate. The more exudate there is, the silver is used up quicker. So you will have to change it quicker, but it is good up to the 7-day mark. The expected outcome of this dressing, because it is an antimicrobial, you will want the local infection gone within 2 weeks and that the exudate is managed well. That's all I have for this video. I will catch you next time.